is Heather Shepard performing the head-to-toe assessment on my 5-year-old daughter, Corey. So the first thing I would do coming into the patient's room is I would perform hand hygiene, introduce myself. Hi, my name's Heather. I'm going to be your nurse for today. I would provide privacy, put on gloves, identify the patient. So what's your name?
Corey,
And what's your birthday?
August 20th.
Okay, good. Once I've done that, then I'll make sure that she's oriented to time, place, and situation. So what's today?
Saturday.
Okay. And where are you?
At my house.
Okay. And why are you here? Because you broke your arm.
Because I broke my arm.
Yes. Okay. It's kind of confusing when you're not really at the hospital. So now that I know that she's alert, oriented, I would ask her, do you have any allergies?
No.
Okay. Are you in any pain?
No.
Okay, good. Okay, so then I'll start my physical assessment. The first thing I would do, I'd go ahead and start at the head. So I would check the scalp, make sure there's no skin breakdown, make sure skin is warm and intact, and it is. Feel for lumps and bumps, which I don't feel any. I'll go ahead and feel the bilateral temporal arteries, make sure that they feel that they're pulsing equally. I'll go ahead and feel the lymph nodes. Okay, let me pull this down a little bit, please. Okay, so I would go ahead and check the eyes. So I'm having you look right at me. I'm going to make sure that the sclera is clear, that the pupils are round and equal. I'm going to pull the lids down, make sure that they're nice and pink, make sure the cornea is good and intact. Then I'm going to check her reflexes here. So look at me. I'm going to check your corneal reflex. So stare right at my nose, and I would shine the light. She doesn't like the light. I'm going to shine the light into her eyes, make sure that the reflex is symmetrical. Then I would move on to, look at me. Then I would move on to look at my pen line here, okay, and follow it. So I'm going to do my cardinal positions. Don't move your head, just your eyes. There you go, good. All right, so everything looked good there. Can you squeeze your eyes shut really tight and open them up? Good, wonderful. Okay, so then I'm going to check her nose. So I'm going to make sure that it's patent. So take a deep breath in through your nose and out. Good. And then I'll use my pen light and just look in, make sure there's no obstructions. Then I'm going to feel her ears, make sure there's no lumps or bumps. I'm going to take a look at them, make sure that the skin is warm and intact. I'll take my pen light and look inside, make sure there's no obstructions or anything like that. Now I am going to look at her mouth. So first I'll just check the lips and the outside of the mouth. Can you smile for me? Take a look at the conjunctiva and the teeth. Can you open up wide and say, ah? And assess the tongue, assess the uvula, the palate. Okay, good. Can you put your tongue on the top of your mouth so I can see underneath? Like this. Good, look underneath. Okay, now just open it up wide, regular. Take a look at the cheeks. Make sure there's no ulcers or anything on the cheeks. Yes, now I'm gonna have you smile real big and frown and then puff out your cheeks. Good job. Good job. And then I'll palpate the rest of the lymph nodes there. Okay, so next I'm going to put your legs down for me, please. Thank you. So next I'm going to, you don't need to do that. So normally I would do straight on the skin, but to keep her privacy, I'll keep her shirt on. Okay, so I'm going to also take the heart. I'm going to use my diaphragm first, and I'll start. Can you put that arm down for me? Woo-wee. Yep, keep it just like that, and this one too. Thank you. Okay, and just relax for me. I know it itches, please. Okay, so I'm going to start with the aortic valve. Then the pulmonic valve. Then herbs. Tricuspid valve, and mitral valve. So when I'm on the mitral valve, I'm also assessing the apical pulse. So I'll go ahead and stay there for a full minute to get the pulse there. And then I'll switch to my bell and I'll listen for any murmurs in those same positions. Okay, normal heart sounds, no murmurs. Okay, now I'm going to have you look this way. I'm going to listen to the carotid here, and I can assess her range of motion at the same time, no bruises. Okay, look the other way. Good. Same thing, no bruises. Okay, while I've got her like this, I'll go ahead and check her turgor. Turgor looks good. I'll go ahead and put my hands on your shoulders. Can you push against my hands? Perfect, good job. Okay, now I'm going to assess lung sounds. So every time this touches you, take a deep breath in and let it out, okay? In, good, out, good, in, out, good. I'm making sure that I'm comparing each side. Keep going. Almost done. Good. Good. Lung sounds good. Okay, now I'm going to have you sit up and I'm going to listen to your lungs from your back. All right, same thing. Deep breath in. Good. Good. I'm comparing each side. Normally, again, I would be touching the skin on this, but I'm going to leave her shirt on. Good. Good. Okay, good. You can lay on back. All right, now I'm going to move on to the arms. The left arm is broken, so I'll do that one last. I'm going to look at the right arm, check the bony prominences, make sure there's no skin breakdown, make sure that the skin is warm and dry. I'm going to check the fingers, check the range of motion. Does that feel okay? Okay, does this feel okay? All right, good.
To look like in
Okay, I'm going to check the capillary refill on each finger. Okay, good. Now I'm going to come over to this side, just make sure that there's no swelling. Obviously, I'm not going to be able to check the range of motion there, but I could check it at the shoulder. Does that feel okay? Okay, and I can, does that feel okay? Okay, there's no swelling there, no swelling or redness there. I'm going to go ahead and check the capillary refill on each finger. This is really important because you just had surgery on Tuesday, so there could be swelling, and with the cast on there, it could be tight and impeding the blood flow, so make sure that the capillary refill looks good and the fingers aren't blue or anything, swollen or anything like that. Okay, do you think you can squeeze my fingers? Here, squeeze with this side and this side. Squeeze. Good. Okay, bring your hands up and push up against my arms. Push, push with both. Good, that's actually really good. Okay, now, I can't check the radial pulse on the left side because the cast is there, but I'm going to check the radial pulse on the right side, and I'm going to make sure that it matches the apical pulse that I got. It's 2+, it's good. Now I'm going to move on. Now I'm going to move on to the abdomen. So first I'm just going to inspect the abdomen, make sure there's no lumps or bumps, no masses, no pulsations. Next, I am going to auscultate the abdomen. I'm going to use my diaphragm, and I'm going to start at the right lower quadrant. I'm going to listen for bowel sounds. If I didn't hear any bowel sounds, I would listen for a full minute, but she's got good bowel sounds. So I'll just keep going in a clockwise manner. So it was right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Good. Now I'm going to switch to my bell, and I'm going to listen just left of the umbilicus for any aortic bruits. That sounds good. And for palpating this, it's just light palpation for tenderness. Does that feel okay? Okay, good. All right, so next I'm going to assess the legs and the feet. She has pants on, but if she didn't, I would check the skin, and I could still check the skin at the feet. Make sure that it's warm, dry, and intact, and it is. Check the bony prominences, make sure there's no breakdown. I'll go ahead and check the range of motion at the hip and knee here. Does that feel okay? How about this one? Does that feel okay? All right, so then I'm gonna inspect the toes and the nails, make sure there's no clubbing. I'm gonna check the, does that tickle? Check the capillary refill in each toe. Then I'm gonna check the posterior tibial pulse bilaterally. It's 2+ bilaterally. The dorsalis pedis on top of the foot. 2+ bilaterally. Good. Okay, now, can you push against my hands? Good. And then push against my hands here. Good. All right. Okay. And we're all done. Good job.
That was a long video, Mom.